Today we'll be discussing about micronodular lung pattern. First we have to know about the anatomy of secondary pulmonary lobule. This is secondary pulmonary lobule. In secondary pulmonary lobule we have septal structures. This is the interlobular septa. We have septal structures. We have centrilobular structures and lobular parenchyma. Coming to septal structures, we have a pulmonary vein, we have lymphatics, and they continues with the interstitial components. In the centrilobular structures, we have a feeding pulmonary artery, bronchiole and afferent lymphatics, and surrounding peribronchiovascular interstitium. Coming to lobular parenchyma, it is situated between the outer septa and the centrilobular structure. There is a pulmonary acinus. There are about 3 to 30 acini. One acini is equal to the 1500 to 4000 alveoli. And surrounding the acini, we have intralobular septa. So it's very easy. We have septal structures, we have centrilobular structures and lobular parenchyma. In septal structures, we have a pulmonary vein, lymphatics. In centrilobular structures, we have a pulmonary artery, bronchiole and central lymphatics. In lobular parenchyma, we have pulmonary acinus with alveoli, and surrounding it they have intralobular septa. Then coming to basic concept, this is one secondary pulmonary lobule, this is another secondary pulmonary lobule. So each second, in the centrilobular structures we have a lobular artery and a bronchiole. In the periphery we have a pulmonary vein and lymphatics. So this is a interlobular septa and this is visceral pleura. There are three patterns, micronodular patterns. One is centrilobular, another is perilymphatic and another is random. We'll discuss everything. So coming to centrilobular micronodules. So what is a micronodule? Its micronodule is about less than 3 mm in diameter. So these are all the micronodules. They have centrilobular distribution, that is they are evenly spaced. This is a visceral pleura. They spare the pleural surface. Nothing is present along the pleura. So one of the important findings of centrilobular micronodules is they are evenly spaced, they spare the pleural surface, and we have three patterns. They can present as a solid nodule or like ground glass or tree in bud appearance. So the centrilobular micronodules, they present as three patterns. One is ground glass appearance or solid nodules or tree in bud appearance. Then coming to perilymphatic. See, perilymphatic, they are situated along the pleura, along the peribronchiovascular areas, along the interlobular septum. One is along the pleura, subpleural region, along the interlobular septum and along the peribronchiovascular region. These are peribronchiovascular nodules, these are subpleural nodules. So they are not evenly distributed, they are clustered. They are of solid density. One particular thing will be predominant, whether they can be along the interlobular septa or subpleural or along the peribronchiovascular. So they are clustered, they are not evenly spaced. Coming to random nodules, they are located everywhere, like they are not clear distribution. They are not along the centrilobular or they are not along the perilymphatic. See, they are located in subpleural region, they are located in the centrilobular area, they are located along the peribronchiovascular region and interlobular septum. So they are evenly spaced but randomly distributed. They are usually solid. So coming once again, we have three types of micronodular pattern. We have centrilobular nodules, we have perilymphatic nodules, and we have random distribution of micronodules. Centrilobular nodules are evenly spaced, they spare the pleura. There are three patterns: ground glass, solid and tree in bud appearance. Coming to perilymphatic, they are not evenly spaced, they are clustered, they are solid in density and one predominance. They can be along the peribronchiovascular region, interlobular region or subpleural region. Coming to random nodules, no clear distribution. They can present in the centrilobular region, along the subpleural region, along the peribronchiovascular region, in the interlobular septal region. But they are evenly spaced. but randomly distributed. They are usually solid. So, for example, if you see a patient CT with a subpleural micronodules, just it divides in subpleural. If you see a CT of a patient suspecting of micronodular lung pattern, if there are subpleural nodules are there or not, you see if there is no subpleural micronodules, it's centrilobular distribution. If the subpleural micronodules are present, predominantly interlobular subpleural micronodules, perilymphatic distribution. Diffuse without any predominant topography, then it is random distribution. Then coming to differential diagnosis. One of the important differential diagnosis of perilymphatic distribution is sarcoidosis. Other causes are lymphangitic carcinomatosa, silicosis, Kohlwerker's pneumoconiosis, lymphoproliferative disorders, amyloidosis. So these are some of the differential diagnoses of perilymphatic distribution. One of the important is sarcoidosis, lymphatic carcinomatosa, silicosis, Kohlwerker's pneumoconiosis, lymphoproliferative disorders, amyloidosis. Coming to centrilobular pattern with 3-in-bud appearance. So we have infectious bronchiolitis, like it can be bacterial, viral, fungal, typical and atypical mycobacterial infection, allergic bronchopulmonary aspergillosis. These all have centrilobular distribution of micronodules with 3-in-bud appearance, cystic fibrosis, diffuse panbronchiolitis, endobronchial neoplasms, particularly adenocarcinoma in situ, very important. We have infections, we have aspergillus, cystic fibrosis, we have adenocarcinoma. Coming to centrilobular distribution of micronodule without 3-in-bud appearance, some of the differential diagnoses are hypersensitivity pneumonitis, respiratory bronchiolitis, Langerhans cell histiocytosis, lymphocytic interstitial pneumonitis, malt lymphoma, pulmonary edema, vasculitis, pulmonary hypertension, and pulmonary image. These are some of the differential diagnoses. Coming to random distribution, we have hematogenous metastasis of thyroid, renal, and melanoma, infections, fungal, viral, tuberculosis, silicosis, Kohlwerker's pneumoconiosis, Langerhans cell histiocytosis, septic emboli, pulmonary vasculitis. Thank you.